All right, welcome, Dr. Cook. Welcome, welcome, welcome. I'm so excited that you're here. So, for those of people in the audience that possibly don't know who you are, let's start out by giving them a little introduction of who you are and how you got into doing what you're doing now.
Oh my gosh. Well, first of all, thank you so much for the invite. It's great to chat with you. And oh man, it's hard to believe. So, my background, the relatively short story is decided to go into medicine as a senior year student in undergraduate. Went through medical school, had no idea, thought I was going to be a naturopath, but then got to medical school, figured out I could actually fix things with surgery, and then went through that. Knew OBs didn't have a life, and I did like to have a life outside of medicine, but ran across an amazing gentleman who's passed a few years ago. His name was Dr. Robert Franklin, kind of known as the grandfather of endometriosis. I first heard about endo in 1983, so it's been a few years. And he had treated, I think, in his career, 20,000 women with endo is what he said. It was some amazing number. And at the time, you can imagine, 1983, most people had never heard of endometriosis. And here in the sea of academia and, shall we say, interesting personalities, was this just amazing gentleman who just had such a passion for his patients. And I remember sitting in his office, and had seen people from all over Texas. It was down in Houston. And he's like, okay, so I'm going to educate you a little bit about endometriosis. You need to go back and teach your doctor about what this is. And really, he was the mentor of just a kind, compassionate, caring surgeon. And I guess, like a lot of us, that one thing led to the next. And this summer will be 30 years now. I've been out in practice treating endometriosis. And certainly over that time, we've seen changes. We still need to see a lot more changes. And so that's it. But really, I think kind of known not only for the wide excision since the beginning of time, but also an integrative approach and trying to find answers to questions that aren't answered by traditional medicine, shall we say.
Yeah, and I love what you do, and I love that you do take an integrative approach. And for everybody that is listening that has no idea what that is, can you explain that?
Well, I don't know. I guess, Western medicine, and I guess we'll cover some of that in our talk here the next hour or whatever. We've almost gotten to the point, it's really a disease management paradigm, meaning we're going to manage the disease. And a lot of this is, we've almost gotten to the point, it's like if you're not healthy, it's a pharmaceutical deficiency. I'm like, where did we get off on that road? I'm glad we have the tools we have, but if we're really talking about health and wellness, then it's just, it's not that we need another drug to treat people. And surgery is great at what it does. It's a good tool. It removes disease. But as you know, women with endometriosis often have a variety of different things going on. And so it's been a long journey trying to find out what are those things or combination of, and we're getting there. We still have a lot to learn.
We have a lot to learn, and it is interesting that I'm running into like so many women, right? And or people that have endometriosis, and a lot of them are like surgery, 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 medication, because that's what they've been led by their doctors. And they're kind of digging into the wonderful online community that we have, and they are finding that there maybe are other things that could help them manage their pain, on a case-by-case basis before they can even get excision surgery, or before they can, or maybe they've had excision surgery and they're still having pain, and so it is multifactorial, I guess you could call it, right? And
Right.
treatment. So one thing I really wanted to dig into, and I know we were talking about this a little bit earlier, but is that pain post-excision surgery, right? Because so many people, myself included, right? Like I still have this left side pain, even though I've had excision surgery, and I'm running it. And I was chatting with some other people in my audience, and they were saying like, why am I having all of this pain? Am I needing another surgery? Like, what is causing this? I thought it was all gone,
Right. Right, and that's a great question, and there's so many aspects, but we'll kind of try to work through it a bit. So let me see. Well, gosh, Pandora's box. Where do we start?
Right in the beginning, let's do it.
So I guess, so, there's kind of the traditional, so part of it is trying to figure out what is the character of the pain. And one pain isn't just one size doesn't fit all. Some is episodic, some is constant, a variety of different things. So the more common things that probably a lot of your audience knows about is, so we have one question always, and we can always come back to this, is it really excision surgery? As I've long since said, the internet's going to be so empowering for women, and it's going to be a grassroots effort. In other words, women going in saying, no, I don't want that burning surgery. I need excision surgery. And so what I've seen, and real briefly, as far as empowering women, is I'm seeing some op reports saying excision surgery, but they're really biopsies with burning, and so look at the pathology report. If the size of the specimen taken out is a couple of millimeters, that's not excision surgery. You need centimeters. So that's one briefly. But then there can be adhesions, there can be scar tissue, there can be other things going on that contribute to pain. Uh, there's things like interstitial cystitis, painful bladder syndrome can be an issue. I think we all know about musculoskeletal kind of biomechanical problems. And they, my argument too is endometriosis can be a fairly acute or short-term issue. But in the United States and Western countries, on average, we're seeing close to 10 years, between onset of symptoms and treatment. So we're taking what should be, hopefully, most cases, a more short-term issue, and it's becoming now semi-chronic because there's been pain for so long that we're having a domino effect where other things are coming into play. And so scar tissue, look for varicosities, pelvic congestion, deep pain, the psoas muscle, PSOAS, goes from the leg, the femur bone, up to the lower back and right under the ovaries. So with pain in that area, we can start getting muscle spasm in that area. And, muscle spasm, well, it can be really 10 out of 10 level pain. And that's deep, it's a big muscle. Symptoms can be pain going up, worse up stairs or walking uphill, standing up. Those are kind of telltale signs. It may be the psoas. So the one thing that, again, over the years we're trying to preach is pelvic floor physical therapists, they're like angels on earth, and, for some physicians, like, no, but in some patients, are like, you want me to go what, do where? And it's like, don't trust me,
Yeah.
just go and see. And these are women that, because these muscles, they're in private areas, they don't know they're in a private area, but they can still cause a lot of pain. And most physical therapists don't go there. And so we need pelvic floor physical therapists, women that are interested, and just like with endo, it's not treated, it's not taught often in a residency program like it should be. And physical therapists don't get teaching of the pelvic floor muscles and whatnot. So they have to have a special interest. And again, it's changing over time, but you have to make sure you get to the right physical therapist that's going to do the right evaluation and then the right treatment. You can get back problems, you get disc problems, can be an issue. We talk about craniosacral therapy. You have the dura mater that surrounds the brain and goes down the spinal cord that can cause craniosacral is down in the pelvic area. And so a history of head trauma, head injuries, or even not, it can affect all the way from the skull down to the pelvic area. And so those are often things that can come into play. I'm just going some random things, Tarlov cysts, those are diagnosed, a few of those that can cause pain down in the pelvic area. And then GI issues, we can talk about that a bit. There's as I say, if physicians don't know what they're talking about, they give it a fancy term, and then they sound smart. So you have IBS, irritable bowel syndrome. Well, we're starting to understand a little bit more about that. We can go through some of what's been in that wastebasket term. Um, so, the microbiome, I mean, the list kind of goes on as far as different things. And then we get into the whole centralization of pain, neuropathic pain, those kind of things. So those are some of the probably more common things that we see.
Yeah, and I recently had Dr. Olson from Intimate Rose on a few episodes ago. So if anybody is interested in pelvic floor physical therapy, go listen to that episode. Check her out; she's amazing. But it is like what you're saying. It sounds there are so many other things that could be going wrong besides endometriosis, and if you're not diagnosed quickly, the longer your progression of your disease, right, the worse it can get. Do you see like a lot of organ damage and things like that for people that it takes 10 plus years for get diagnosis or?
No, it's a good question. I think every question brings up more questions. So endometriosis is one monolithic disease. Personally, I don't think so. Dealing with this over and looking as many insights as I have, I think we could divide it into non-invasive disease and invasive disease, stage 1, 2 versus stage 3, 4. And I don't think 1 and 2 progresses into a 3 and 4. So it gets more painful over time. The disease progresses, but physically, it's not going to eat away at the organs. 3 and 4, yes. I had a 23-year-old yesterday with horrible stage 4, bad enough I sent it off for a frozen section, make sure it wasn't cancer. It looked that bad. So yeah, that's going to eat away at stuff, and the longer it's there. But even in the non-invasive endometriosis, although it won't physically damage the organs, I think it's altering the nervous system. And we can then get changes both in the peripheral nervous system and in the brain that even if you take the original thing away, now we have a condition in the nervous system that's persisting in pain, kind of giving a false signal. In other words, there's a problem when the thing that was the problem is taken away.
Yeah, it's kind of like an abnormal pain pathway to that area. It thinks the pain is still there just because it's kind of been like hardwired in, even though
Right,
the stimulus is gone.
right.
So that's interesting. So you don't think like, well, you don't see like stage 1 and stage 2 really progressing. Well, what if somebody like has never had surgery before, and they just like, should they wait and try to manage their symptoms like holistically with diet or do you always recommend excision surgery?
Well, and that's a really good question. And I think with endometriosis, so as I've said, it rarely will kill you. I mean, there may be days you wish it would, but really, when we're talking about treatment, we're talking about quality of life, and and it varies. So there may be somebody that says, boy, I got a day or two a month. It's just really bad, but the rest of the days I feel fine. I'm good, and that goes all the way to the other end of the spectrum where I can hardly get out of bed every day, and this is just, I'm basically non-functional. And that can certainly, that progression's common. And, I think women really take a hit, of, oh, you don't handle pain well, or, oh, you had this or that. And no, it's horrible. I can't tell you how often women are sitting in my office a couple days after surgery, and I'm like, "How's the pain?" They're like, "It's nothing compared to what I go through every month," and that's just a testament to how severe the pain. And so, and so most women are, well, I shouldn't say most, a lot of women are in a situation where they're not getting good support and they're not being believed, they're being invalidated. And so they get up, they put on a good face, they're trying to go about, doing their life, and they often don't want people, oh, what's wrong? So they're trying to just not show it, and push through it. And I don't care who you are. This disease, you can be whatever, just average person walking around the street. You could be CEO of a big corporation. This will take you down. Eventually it gets to the point. but it's so insidious. It's like day by day. It's like watching grass grow. You don't see a difference. And so if you're pushing through it, it's like I can still put my left foot in front of my right. So it's not that bad, but it is, and so I think I see women just suffering and pushing through it and saying, well, I can do this. And yeah, you can, but at what cost? So I think the focus should be quality of life. How much is this affecting your quality of life? Not can you make it through the day? And I think often we get to that point. While I'm surviving, well, I took care of this. And so how much realistically, kind of stand out from yourself, as much as you can as a third person. How much is this really affecting your life and what's going on? And so that's one question on one hand. Another end is, well, what steps can I take? And certainly, if I've had patients come in thinking that they need excision surgery and they actually have a gluten sensitivity. And they often look at me like I'm nuts, but come back a month later, dang, that's about 80% better. So does that patient need excision surgery? Absolutely not. I mean, so if we can take, so one is, and speaking for myself much of my life, I was not in optimal health, and there's a lot I can do to help improve that. So if there are things we can do from a natural standpoint, from an integrative standpoint, and it makes a difference, enough of a difference in quality of life, then yeah, no, I mean, none of us want to go through surgery. And if we don't have to, please don't, So I think that whether it's acupuncture or diet change or any of the integrative things that can be done, yeah, it's worth a try. Is what's the potential benefit? What's the potential downside? What's the cost? And then that's the other thing and stuff with endometriosis. What may work amazing for one person may not have much effect on another. So it's kind of and again, I tell women, listen to your body. You live with your body. And so if you have an integrative, non-invasive approach, I would try it. I had to have my gallbladder out. What did I do? Personal story. I went to my chiropractor. Rob, you got to help me out. I don't want to have surgery. And I worked at it for 2 years, but eventually I got my gallbladder out and I felt better the next day. And I'm like, you silly boy, you're just like your patients. But yes, let's start non-invasive. Let's start natural. Let's try to improve health and see. And if we get the results, great. If we don't, we're still in a better position to go through surgery and have better recovery. Because I think we integrate all these different philosophies, which is diversity is good. We respect each other and use these as treatments together.
Yeah, and I think I think I saw one of your posts or something like that on Instagram, and you're like, just because you don't have the endometriosis lesions in your belly doesn't mean that you're automatically healthy. And so it really does take that integrative approach and really like trying the other things and like what's the worst case scenario, like you're eating a little bit better.
Exactly. Which all of us. And so, I've taught on we have the Endo Thrive membership, and I talk about the 5 pillars of healing from endometriosis. And, it includes, so you have all your traditional stuff. We have integrative as far as personal health and diet and that kind of thing. There's the environment. Then we have healing from trauma, which the physical changes of trauma. And then we get into my favorite part, which is quantum physics and manifesting and energy over matter and that kind of thing. So that's which, ultimately, yeah, anyway.
No, that's amazing. I would love for you to chat about that a little bit more just because I am very much into that aspect of healing and really looking at us from like a health, relationship, spiritual aspect of things and using all of those aspects in healing. So I'd love for you to chat about that a little bit more.
All you want. Just got back 2 weeks ago, spent a week with Joe Dispenza in a week-long course, and we did a lot of meditating.
Yeah, amazing. Oh my God, I love Dr. Joe.
It's crazy. And I met with their research doctors, and we're talking about some potential projects, but they're doing some amazing science. And so anyway, yes, I think so. It's combining all that stuff. And to answer your question, ultimately, yes, if we can start conservative, do what you need to, get your house in order, do as much as we can. And if we need, then we need wide excision surgery. Because I've said, if a car is parked on your foot, you can do all you want, but that car is still parked on your foot, and you need to get it off.
Yeah, exactly. And I really love that you kind of push for the integrative approach first as well, anyway, because I don't know, I feel like I've run into a lot of doctors where they're like, oh, yeah, we'll just take a peek inside, like we'll burn off whatever we see. And I know I've had 2 ablation coagulation surgeries, and I had no pain relief afterwards, right? And it caused a lot more scar tissue and a lot more damage to my organs than probably if I would have just had excision surgery. But I'm from Montana, and there isn't even a surgeon up there, which goes into like a whole nother like slew of things we could chat about, is like, how can we get more people trained in endometriosis excision surgery? How can we make this more accessible?
It's there's so many issues,
I know.
hurdles that we have. But again, I think these kind of forums, discussion, talking, and I'm just such a believer in knowledge is power, and we just need to empower women, and it's not uncommon, and it's a good thing at this point in time when the patient walks in knowing just as much as their doctor does. I'm going to keep them accountable.
Yeah, exactly. And I know, well, okay, I think it might be like working in healthcare for 6 years for me, because doctors don't scare me, but they used to be very intimidating. And I know, like, I push for this all the time. I'm like, you can question your doctor, you can ask like more questions, ask all of the questions. And if you don't like their plan of care, you can always get a second opinion. It doesn't always have to be that one doctor is the one and done.
Right. Well, and I think these are such important issues that to me, well, one question is how we find a great excision surgeon. Well, we can talk about that. I think first, if you can find a doctor that'll sit down and talk with you and listen to your concerns. And also, I think, to me, it's a good sign if a doctor doesn't pretend like they know everything. They may say, you know what, I'm not sure, but let's find out. Let's find somebody that can help us out with that. Because if you have that kind of working relationship, then you got a great foundation to go forward.
Yeah, exactly. It's just, you have to kind of trust them and be able to have that conversation with them. And I mean, nobody knows everything. Doctors are just people too. They are
Right.
continuously learning, and they've gone to medical school, but doctors are just people.
Never
We all
forget
make mistakes.
how
Yeah. um, okay. So if anybody is listening and what would you recommend for somebody who is still like fighting to get their doctor to believe them so they could get like diagnosed with endometriosis? Like, would you recommend they seek out an excision specialist right away?
if possible,
Yeah.
we're getting there. We're making progress. There's no certification program. There's not even a standard. To me, the first thing we need to do is get standardization and how do we do a diagnostic laparoscopy? Because I see so often where it's not done properly and the endo's missed, and and along with that, I believe it's time that the standard is not only do you take photographs, but at least for the diagnostic portion, that you video document, what's being done. Surgeons may be afraid, well, if I do something wrong, then they're going to sue me. Well, okay, well, just the diagnostic part. You're looking around, just videotape what you're doing. Then you can hand it to somebody else, for an independent evaluation. And so ideally, yes. But if you have the concern I have, if you have a doctor says, yeah, I don't think that sounds like endometriosis, but if you insist, I'll go look. How good a job are we really going to get? And again, if we can get them to do good photo documentation, ideally at least video of the diagnostic portion, then that's at least we have some objective information as far as what's going on. And so I think, yeah, talking around support groups, word of mouth, if a patient knows some nurses at the hospital, that's often a good inside track, okay, who would you go to?
Yeah.
Uh, and get the scoop that way.
Yeah. And so is that something that you could request from your OBGYN is for them to do an exploratory lap and not burn off anything they see and just take a video and image?
You could, and
Would insurance even cover something like that? I have no idea.
it's possible. The So let's take a minute to talk about that. As far as, so, is there a blood test? No, we have CA-125. Sometimes it's elevated. Can you do an MRI and see it? Sometimes you can, usually just with invasive endo, but the majority of endo, you're not going to be able to detect it ahead of time. I think with a good history, in other words, there's the classic presentation, variation of ways that it shows up. You're a woman, you started having periods, they weren't too bad for a couple of years. They've gotten progressively worse pain-wise over time, often more intense pain, more days are hurting. If intercourse didn't used to hurt, now it is getting progressively more painful. Lower back pain, pain radiating down the legs, fatigue, often bowel issues. You probably have endo. To me, guilty until proven otherwise. And again, if you've done the basic, diet elimination or things, then we're at the point that, okay, to diagnose it. So that's almost a screening test.
Yeah.
In medicine, there's screening tests, there's diagnostic. We want ideally 95% on the screening test to pick it up. But if we're 80, 90%, we say, sounds like you have endo. We should go do the diagnostic test. The problem with the diagnostic laparoscopy is it's very surgeon dependent on how accurate it is. So, and I'm going to do some posts probably over this next week if I get done what I'm supposed to get done. But with a laparoscope, if you're far away, you see a big area, but everything's really small. If this is the laparoscope and you're coming in closer, it's what we call near contact laparoscopy. And the closer you get, the smaller the area you see, but the more everything's magnified. Because we're looking at a TV screen, basically. And you have to I can't tell you how often, we just look in from a distance, wow, is there endo here? And as we get in and look close, then it's like, wow, there's endo everywhere in here. And so and then you have to look over the bladder, and literally we're going back and forth, looking at the tissue. And then we have to get the uterus up and the ovaries up so you see all the way. You have to get all the bowel out. So really we have to, people are like, well, is it kind of like looking to see if there's a picture on the wall? No, it's more like you get up in the morning, bed sheets are messed up, and there's a quarter in there someplace. We're going to have to go through each layer, the comforter, the sheets, look under each layer. And so really looking thoroughly. And that's what's required to do an adequate diagnostic laparoscopy. So no, they're not. And that's where I'm okay. So for the battle is to try to get better treatment. The first step is to get better diagnosis. And if we could at least get your average, like you're saying, go to your average OBGYN, they can do a thorough, qualified diagnostic laparoscope, videotape it, and then if they're comfortable and qualified to do wide excision, great, because it's not the easiest thing. Not everybody can do it. But if they can at least get a diagnosis, then we could say, all right, we know we have the surgery, the endometriosis. Now let's get you the right person and break it down into steps.
So how could we get that standard of care out into the general public? How could that be? How is that even going to be possible?
Yeah, it's a good question.
Would it be like an ACOG?
It may be that, if I'm hesitating a little bit because I just need more of me. I do have a nonprofit, the World Society of Endometriosis Surgeons, and part of what my stretch goal is to start putting guidelines out there. So if there's anybody out there that has experience with nonprofits and wants to help, I'd be glad to use the help. And I think those kind of things, and then I don't know. I mean, that's the first step. Putting out the steps and then trying to have people that will adhere to it. So.
Yeah, I think, well, that's amazing. So yeah, if anybody it does have experience with nonprofits, I'm going to put all of your info below, like the podcast and YouTube and all the things, so you guys can contact Dr. Cook there. But it kind of feels like we need like an entire medical system upheaval, which seems like a really big, like
Mhm.
big task.
It is. Unfortunately, it is. And, we have the Endo Foundation of America that's doing some good work. And I think it's just kind of women refusing to receive substandard care. And it's a push over time. And is it right? Is it fair? No. But, I mean,
So
as I've
yeah,
said, I don't think I'd want to meet most endo patients in a dark alley. I mean, forget, we just have to.
no, we're a
Yes.
tough bunch. Yeah, and I mean, hopefully in my lifetime that would be amazing.
Yeah.
If a patient could go to the doctor's office and get that, like what you were saying, the proper actual diagnosis right then and there. Putting out guidelines, that's really cool. I also didn't know you had a nonprofit, or you were starting a nonprofit. That's really awesome.
Been around for a while. We're just a lot of more ideas than time.
Yeah, good. That's good though. um, Going back to what you were saying a little bit earlier, because I've spoken to so many women and they're so excited because their gynecologist finally agreed to do like an exploratory lab. And then they get in there and they wake up and they were told that they don't have endometriosis, but they have all of the symptoms of endometriosis. And I've had to reassure so many people and be like, yeah, but they might not be trained to see all of the different presentations of endometriosis. They might not have done like what you said, get up really close and like zoom in and look at the wall and look at all of the peritoneal changes. Go to Dr. Cook's Instagram. He has so many videos, and his IGTV, like surgical videos. If you guys are interested in this, go look at that because they're very cool. Again, that's me, my healthcare nerd side. I'm like, show me all the videos. But for somebody that happens to, what do you recommend? Just getting a second opinion?
Yeah. Again, it's what we've talked about previously. If they haven't gone through all the
Yeah.
things that, because there's a lot within the power of the woman to change. It's harder, it takes more effort, but there are things. And so make sure you've exhausted all those things and gone through it. And then if there's a question, yeah, and that's because that's kind of what happened to me fairly early on in my career. I had a patient and she'd come in and basically she had had surgery 6 weeks before. And she said, look, I know I'm not a doctor, but I live with my body and I'm telling you something's wrong. And I remember looking at the op report and it was like no endo, clean pelvis, blah, blah, blah. And looking at her and I thought, we can go look. And we did. And there was endo, I don't know what they were looking at. It was all over the place. And it was pretty obvious. I mean, I don't know. But the lesson I took home from that was trust the patient. And that's why I say trust your body. You do know what you're talking about. It's part of the interesting part of my job. I get to listen and then I go see. And it's like the patients direct you to what's going on and where it is. And you guys know what you're talking about. You really do.
Yeah, and I mean, you're living in your body. You know your body better than anybody else on this planet. So if you think that something's wrong, something's probably wrong. But I run into this and people kind of feeling like you almost like lose the trust in your body, right? Because you have this pain and somebody's telling you that it's not there, it's just in your head, like you're making it up. And what would you recommend for somebody like that? Because I know like that's kind of what I help my clients with, right? Is that mindset and the mentality behind learning to trust your body again and really learning to live with endometriosis and live well with endo, even if you do have a little bit of pain, you know?
Right. And so, if there's been a missed diagnosis, or as often, or probably more often, underdiagnosis and undertreatment. I just did a case this week, and I'm going to make a series of videos on it because it's such a great teaching video. She was diagnosed a year ago, and they did the spot burning surgery, and we went back 2 days ago, and it was just so impressive. And so to be able to show the different approach. So it may be there, they may be living with the endo. If you've had a good endo wide excision surgery and you still have pain, it's real, okay? There's no question. We don't have the level of diagnosis. Now, the other thing that we touched about, as far as energy and manifesting and all this, I mean, that's a rabbit hole we could go down over many episodes. And, kind of what Dr. Joe teaches is, see if I can summarize it a bit, but, basically, as humans in this time-space reality, we spend so much time, really perpetuating the past, and that past predicting what our future is, and so, we've been conditioned into the very known routine and known response. And what he's talking about is if you get actually in the present moment, really, and that's where with meditating and getting there, then that's where you get into the unified field of infinite possibilities. And we're getting out of this time-space reality. We're connecting with source. And that's where, so, you know, most of us, I think our body has taken over control of our mind. And so the body may be in pain, it may be hurting, but we can almost escape it, which, in a lot of ways, in talking to endo patients, like, I wish I could just take a vacation from this thing. It's relentless and they never get away. And it's not easy. It takes time, it takes effort, but I think there's a lot of potential there, and it's easy for me to say, sitting here feeling pretty good, and then I get a runny nose. I'm like, well, that's so hard. So when you're hurting so much, it's like almost asking the impossible. Yet, if a person has enough determination, more determination than what they're living with, I think there's potentials there, that could be explored.
Yeah, for sure. And for anybody that doesn't know, Joe Dispenza, he is like a meditation guru. What is he does he have a PhD? Is that?
Actually, a doctor, a chiropractor, and he had a back injury, and they told him he would never walk. And he overcame, in an update, which I wasn't even familiar with before spending the week there, I up to about 400 cases of a variety of different diseases, including stage 4 cancer, that have been eliminated. And he says, if you have to become a different person, because energy is what dictates where matter goes, and how matter, E equals mc squared, how matter manifests. And it's probably a holographic universe. So if you become that person without that disease, the disease will disappear. And we're just learning, how do we do that, and he's getting better. I mean, it's within the realm of possibilities if somebody is so inclined, and everybody's different. So what you connect with is different, but I would encourage people to look at it, and I'm going to be doing more on that.
Yeah, it's really interesting stuff. And I've had a couple of different like energy healers on the podcast and on the show, because I 100% believe in that, like our mind and like our thoughts are so powerful, and like shifting to a separate vibration, kind of, like shifting your energy into being that person that doesn't have the disease, or being the person that you even want to be, and not this, like, I know when I was like deep in the throes of my like pain and suffering, I was angry and I was upset, and I was like just not who I am right now, you know? And it took so much shifting to get to where I am right now, where I have more good days than bad. And it wasn't just like mindset, it wasn't just diet, it wasn't just surgery. It was like we were talking in the beginning, it's like a whole slew of things, but you have to like make that commitment and you have to be willing to shift everything.
Right. Absolutely. And it's just another way that endometriosis is so mean, because when you get into survival, it narrows your focus down and you're surviving, and you're trying to control and make sure everything happens, which is normal. I mean, it's just part of being human. And part of getting into that different energy and that higher vibrational level is where you're open and welcome the unknown. And so endo's like pulling you over here. And if we're going to grow spiritually and as humans and get to a better place, you have to almost escape this thing that's kind of trying to tie you down. And so it's doubly hard, but I think it's still possible for women with endo. And I spent years trying to meditate, and it was like pulling teeth. I'm like, I'm just not a meditator, and
Yeah.
I've got the point, Bailey was even saying, I mean, I'm up almost every day, late as 4:45. Sometimes I woke up at 4 this morning, like, oh, perfect. My pineal gland's great to meditate. And I'm meditating. It's like, I love it. It's like the best part of the day now, because I've learned how to connect with source and get into that place. And I mean, it's like, I mean, if people can get there, it's a great escape.
It really is. And it almost like gives you energy and like gives you life after that meditation, right? When you are actually like in it, not just sitting there like thinking about your to-do list or like letting all of the thoughts pass by. Our brains think automatically, we can't control that, and so just like let them pass.
Yeah.
You can also, oh no, you go.
Because you gotta be no one, nowhere, no thing, no time, nobody, where you just pure consciousness. And yeah, that's hard, but and again, you start to get to where you can separate from your body and your pain, because theoretically, easier said than done. You can be in pain, you can be suffering, you can be miserable, you could be in a really good mood and hurt like hell. Not easy, you know, but and that's where ultimately quality of life, even if you couldn't get rid of all that pain, if you can get in a good place, which I think you're a great example. I mean, you've walked the walk, you know.
Yeah, exactly. And that's like what I help my clients with, right? Because it's how you perceive your pain, right? Because sometimes we are going to have pain, and that doesn't mean that it has to control your whole life or ruin your day.
Right.
Well,
And I think it's interesting. One thing I've seen, observed over the years is there's, so is it acceptable? No, we don't want to be there, you know. And I see a subtle shift in people where, okay, this isn't acceptable, but right now I'm okay. And I don't have to get rid of, it's not conditional, you know, because if I have to get rid of this pain before I can be okay, that's a tough road. And it's a subtle shift. So it's not surrendering to the pain. It's saying it is there and I'm still me. And, I mean, I don't know. It's a difficult concept to fully
it is,
describe.
but I know exactly what you're talking about. It's like I still have this pain and I can still live my life. I can still be okay. Like I can still be happy, you know?
Right.
And I
I'm
think,
an
oh,
individual who is in pain.
yeah. Do you know who Gabby Bernstein is?
I've heard of, I'm not real familiar with.
She kind of talks about this a little bit, right? Because she went through a whole stint. Oop, my sorry, dogs are barking. She went through a whole stint where she was in a lot of pain and suffering, and she separated it herself, right? Because she was like, my body is in pain, my spirit is still whole, you know. And she was able to like do the I'm in pain, and by separating her body and her spirit that way. And she's a big meditation expert, teacher, all of that fun stuff.
It's very fascinating because really, historically, people have looked at it as woo-woo stuff, but in a lot of ways, medicine's 100 years behind most all other industries. This is all Newtonian physics, matter versus matter. When we start looking at quantum physics, which is responsible for our computers, we have quantum computing and all this stuff that is hard to wrap our brains around, but it's one of the most documented aspects of physics. And so when we start looking at, you talk about wave versus particle and what is reality, really it is, if we can vibrate high enough, then that's where we start to change what's going on, because if we're living just reacting to matter, and oh, I'm hungry, I'm going to go to the kitchen. I mean, that really is all past stuff. It's already happened, it's already converted. And I don't want to lose everybody in quantum physics, but it's real stuff. I mean, it's very proven. It's just the average, it's so hard to understand the average person. They've kind of gotten left behind in what our understanding of what is the universe, who are we?
Yeah, exactly. And I think, what would you suggest for somebody who is trying to vibrate higher, right? To get to that higher vibration other than meditation, or is meditation like your number one go-to?
Well, that's a really good question. So one is, again, if nothing else, there's, Joe's written a couple books, just to try to help some of the understanding of it. There's trying to relax helps. And there's a lot of stuff online, even like these visual kaleidoscopes. You can just kind of chill out. And there's music, 432 hertz, can help. Ironically, if you're in a position, helping other people helps raise your vibe, and so if you, because that's part of what they're doing now with COVID, they're actually working on remote healing, and they find that the people that are being healed do get a significant response. The people doing it, because you're really trying to connect with love and peace, and the more you can do that, that helps raise your vibrational level. And so if you're volunteering or doing something for somebody else, that naturally raises your vibrational level. So, and there's another thing that is a good tool is heart math. I don't know if you've heard of heart math, but they look at heart coherence. And so there's a device that goes on your finger and it gives you a little feedback. They have a machine, or you can use it on your iPhone. And getting that coherence, because they've done, and there's, again, pretty good science behind this. So the heart's just not a pump that beats. It actually sends out this electrical field, an electromagnetic field, and it's sending information to the body. And so elevating, so wherever emotion level you're at, there's one above it. And it may be anger is above fear. I mean, so it may not be into a positive emotion, but if you're going up the scale, then that's a good thing. So baby steps, just baby steps.
It is baby steps, and it's not expecting to jump, like you just said, from anger to like pure joy. There's a scale, and is that the name of it? Is it the heart?
Well, the heart math is helps with coherence, but yeah, I mean, you can Google, energy levels or, emotional levels and stuff, and look at that. So, whatever you connect with. Some people, it can be painting. There's some people just doing the dishes. I had somebody who was like, painting houses is my meditation. It's like whatever you connect with, and just kind of. And just get some of that noise out is helpful.
Exactly, because I mean, healing can be fun and creative, and it's just kind of whatever you resonate with, like anything that kind of brings you joy or makes you really happy or fills you with like love. Any of those things are going to really help.
Mm-hmm.
Oh no, sorry. No, you go ahead.
I was just, trying to I think a lot of this, it's like connecting with your authentic self. And so, well, what's your authentic self? And, I hadn't thought about that, so are you on a path that really is true to yourself. Because I've, and so some, and because I think, again, as women, you're supposed to take care of everybody else, and it's like, if you take care of yourself, you're selfish. Well, all right. At the center of self-care is the center of healthcare, and so it's okay to block out time for yourself. If you have a bunch of kids and your husband comes home, it's okay to say, you know what? Why don't you watch them for an hour? I'm going to go soak in a tub, light a few candles, and you know what? Because I'm worth it. And that's okay.
It's okay. It is okay to receive and kind of take care of yourself and lean into just self-care.
Yes. And I would encourage people, because often if you haven't and you start, you feel really selfish. It's okay. Keep on going. You're worth it. It's not, because selfish is kind of has the connotation there's something wrong with it, or but you can't give away what you have. So you need to take time to recharge your batteries and nourish yourself.
Yeah, exactly. You can't pour from an empty cup as much as you would like to.
That's right.
Um, well, thank you so much. I love, love, love how you've integrated and how you like, I don't know, I'm like over here doing a little happy dance talking to a medical professional who's also talking about meditation and energy and all of these things. It's bringing me so much joy. Thank you so much for coming on. I know everybody listening probably got a ton out of this episode. Is there anything else that you want to share with anybody or share with the listeners?
No, I mean, just thanks so much. I really appreciate it. And I think that the thing to leave with people with is listen to yourself, and there is hope. There is hope. Don't give up hope, and keep on going.
Ah, this was so beautiful. Thank you, Dr. Cook. You're amazing. Everybody go follow him, find him, chat with him, all the things.
Kind word. Appreciate it. And thanks for what you're doing. But together, we'll make a difference.
Yes, for sure. There is hope. I love that.
All righty.
Thanks, Dr. Cook.
Bye.
Bye.